Good evening and welcome this Saturday evening to a series of critical conversations that we are hosting with Scroll by Consulting and Survivors Against TB. My name is Chapal Mehra. I'm a writer and a public health specialist. And today we're going to be talking about mental health self care during this pandemic. Fear, anxiety, and sort of stress have become the most common human emotions right now across the world. People are uncertain, unclear of what is happening around them, how long this pandemic will last, and what are the challenges that it poses. Perhaps one of the things that has come to the fore is our mind and our mental health and our collective mental health in families, in communities, and in populations across the world. How should we cope with the rising uncertainty around us, with the rising stress levels around us, and more importantly, with an uncertain future, both that sort of straddles all of humanity? Every time the pandemic dips somewhere, the caseloads rise somewhere else, and we are realizing that while all of us may be in this together, taking care of our minds has become possibly as critical as our immunity and our ability to fight this virus. So while we wait for vaccines and for cures, perhaps one of the most fundamental things that we can do today is to take care of our thinking, of managing our thoughts, and also possibly about taking care of people around us. So, without further ado, let me introduce my guest for today evening. Um Dr. Saurabh Mehrotra is a well-known psychiatrist with Medanta. Welcome, Saurabh. Thank you so much for joining us. And we're going to be talking to you today about how we can manage uh, self-care and mental health during this pandemic. Uh, Before we start, let me lay out a few ground rules. First is that we will be taking live questions. Saurabh is a very well-known expert. Uh, so please go ahead and ask your questions and we will try and address all of them. The second, of course, is that we'll try to make this conversation bilingual. It means that many of you have said before that you like to hear some responses to some questions. So you हम जो इस वक्त मानसिक स्वास्थ्य और अपना ख्याल रखने की कोशिश की बातचीत कर रहे हैं वो भी इस महामारी में, तो हम इसको अंग्रेजी और हिंदी दोनों में बातचीत करने की कोशिश करेंगे ताकि ज़्यादा से ज़्यादा लोग से जुड़ सकें, इससे अपने सवाल पूछ सकें. So sort of let me first start with you about the question that we are grappling with today, that we are all trapped within our homes, and there's a lot of sort of economic uncertainty. People don't have jobs. People are looking forward to understanding what we should be doing, and it's all affecting our mental health. Uh, are you able to hear me, Saurabh?
Yes, I am. The voice is fluctuating a bit. I can hear you now.
Okay, all right. So I was just curious to understand, what do you think this pandemic is doing to our mental health? ये महामारी हमारे मानसिक स्थिति पे क्या असर कर रही है? How is it impacting us? Give us a little idea.
Sure. So, ever since the pandemic has started, our mental health has been affected in various ways. We have the fear of the illness, the fear of acquiring COVID, either for ourselves or for our loved ones. That's leading to a lot of anxiety, especially when we are looking at an illness for which we really don't have a definite cure. And every day through the media, we hear new aspects about the illness. Then what it has done is it has led to a lockdown, and this is something which modern man is not used to at all. We've never lived or even contemplated our lives in such a manner. So the mere fact of being at home or working from home is something which is very frustrating. We've always taken pride in the fact that we are a 24/7 society. Everyone and everything is available all the time. And now that's completely turned upside down. So that's leading to a lot of frustration. That's leading to a lot of distress. Apart from that, we know that the economy is in shambles. People have a genuine threat of either losing their jobs or facing a salary cut. And that's again something which really worries us and bothers us. And new things, we are having to get used to new things, such as children which are studying or doing their education from school. Many of them were doing going to daycares. We don't have helps available with us at this particular point of time. So all of this put together is leading to a lot of stress and distress. There are estimates which now say that, of course, all of us are in a state of stress, but almost half the population is going through significant anxiety or sadness or depressive symptoms, which requires care in some or the other manner.
Uh, Thank you so much सौरभ. You put it all in a nutshell. आपने एक साथ सब कुछ बताया हमें. But when we talk of mental health, a lot of people consider it a luxury. You know, they consider कि ये तो जिनके पास पैसा है, people with money, with means are the only ones who are able to access mental health care. But now it has become an epidemic of sorts, right? In India, it was always at a very large scale. Now, if I ask you, for any average person, what are the signs we should be watching out for? Because, you know, we are not told ever that you have to take care of your mind. Nobody tells
Sure.
you. All our narratives are around अपने आप को ठीक रखो, अपने आप को physically fit रखो, अच्छा खाओ. मगर दिमाग की कोई बात नहीं करता. Nobody talks about the mind. And so, what are the signs that we should watch out for when we are thinking about taking care of our mental health uh, today, in these times? Because we're looking at long term mental health care right now, and self care is very important.
Yes. Uh, so we have this category of what we call the common mental disorders, which may affect as much as about 15% of the population. So that's a substantial number of individuals, and this is, pre-COVID. Now, what are the things to look out for is that invariably, if we are in a state of high stress, or if we have some sort of a psychological issue, we will have problems in sleep. Most people will sleep less, but some people may actually sleep more. The same thing happens with our appetite. We tend to lose our appetite, but some people may actually eat more, and there is an entity which is called stress eating. So we tend to eat more, we tend to binge, we tend to have a lot of craving for sweets and chocolates. So sleep and appetite are affected. Apart from that, we may notice that our mood is no longer the same. We experience a disinterest towards things. We don't feel like doing things. Our motivation levels may drop. Our energy levels may actually drop. People will complain about the fact that their energy levels are very low. Even physically moving from one place to another is a task in itself. Then there is a change in disposition. We tend to become more irritable. We start snapping at, the most trivial of things. We tend to worry a lot. So we may find that our mind is always in a thinking mode. We are overthinking. In fact, some people will come and tell you that even when they sleep, the mind doesn't seem to sleep. So even in their sleep, they continue to, brood or think over something or the other. So thinking too much, overthinking, worrying a lot, this is what we see. Anxious people become extremely anxious. They are always on the edge. This is what we commonly see. People develop a lot of physical symptoms as well during periods of stress. So people may develop headaches. Now we refer to these headaches as what are called as tension type headaches. We may suffer from body pains, right? We may also have a lot of acidity, gas, burning, bloating, symptoms related to our stomach. So the symptoms of stress are not just the emotional symptoms, there are also physical symptoms. You may find it hard to focus, you may find it hard to concentrate, you may feel that you are becoming more forgetful, you are becoming more indecisive. And if it proceeds any further, if it tends to become serious, then we begin to have thoughts of hopelessness. We generally feel hopeless, nothing is going to be fine. We have negative self image. We feel helpless towards the situation. And in the most extreme of cases, people will start having death wishes. They would feel or believe that they'd rather be dead, and some would actually start contemplating suicide. So, all of these things, if present persistently over a period of days, is a matter of concern, and help should be sought for.
This is really interesting because आपने बहुत सी चीज़ें बताई हमें symptoms which are both psychological and emotional but also physical because people often think physical symptoms have nothing to do with their mind दिमाग और जो शरीर का जोड़ है उसको हम बहुत लोग नहीं समझ पाते हैं this is very crucial. uh, एक बात जो मैं आपसे पूछना चाह रहा था जो हमारे लिए बहुत ज़रूरी है which a lot of people ask us also which is 2-3 सेल्फ केयर स्ट्रैटेजीज मतलब कि कैसे हम अपना ध्यान रखें क्योंकि द ट्रूथ इज दैट मोस्ट पीपल कांट एक्सेस हेल्थ केयर of this kind, mental health care, and also some of them can't afford it, right? So how do we then cope with it? How do I take care of my mind so that I can uh, at least try to live the semblance of what seems to be my life as usual. जैसी जिंदगी चल रही थी उसको थोड़ा सा धीरे धीरे कैसे संभाला जा सकता है? What would be the self care strategies you suggest?
Okay. So many actually, and quite easily doable. On occasions, we tend to forget the basics. We don't realize how the most simplest of things go a long way in contributing to our physical health as well as our psychological health. So, if we talk about the most basic things, then sleep is absolutely important. All of us must ensure that we are sleeping for about 7 to 8 hours every day, and preferably during the night time. Now we have a lot of people during the COVID pandemic where people are sleeping in the early hours of the morning and getting up post noon. So that doesn't really help. Sleep is absolutely essential and vital. We must aim for 7 to 8 hours of sleep. Appetite, something as simple as eating healthy, contributes a lot in ensuring your physical and psychological health. Exercise. Now, most of us at this particular point of time have our share of worries and our share of stress, but people have started using a word called time affluence because we no longer have to commute, right? There is a lot of time at our disposal. So, we have a time affluence. Unfortunately, we are not utilizing that time in the best possible manner. The first thing which we should do once we get up in the morning is about 40 minutes of good exercise. And believe me, if we can use the word miracle medicine for exercise, it's believed to be a miracle medicine. The exercise, 30 to 40 minutes of exercise every day, at least half of it vigorous, is one of the most effective stress busters. It it is a mood elevator. Your mood is going to be better. You will be more calm and relaxed throughout the day. You will be less anxious. You will be more focused. You will be more energetic. Your attention, concentration, and memory is going to be better. It is going to ensure a good night's sleep. And needless to say, it's wonderful for your body as well. Just in case anybody has hypertension or diabetes or cholesterol, it's good for your heart, it's good for your brain. So, something as simple as 30-40 minutes of exercise, we seem to be, missing out on. People can do a few minutes of meditation every day. Again, this is something which India has taught the world, and the entire world seems to be seeing the merit of it and following it, but we in our country are not following it. So it is essential that we learn the most basic of meditation. Meditate for 2 to 5 minutes every day, and that's going to help us a lot. Particularly in the times of the COVID pandemic, we need to cut down on our consumption of the social media. That's another pandemic which is happening. We call it an infodemic of information, and unfortunately, as things are, it's a lot of negative information. We are constantly subjecting our mind to anxiety provoking negative information about the number of cases, about the sort of crisis that individuals may be experiencing. And needless to say, if this is happening throughout the day, we'll get ourselves extremely anxious and extremely worked up. So let's reduce our cut down of the social media, and assimilate less of information. 5 to 10 minutes is enough in a day if we need to understand what's happening as far as the pandemic is concerned. We should spend some time in what I refer to as positive addictions, which would be something like reading a book, which would be something like listening to music, which would be something like the fine arts, drawing, painting, gardening. For some people, cooking is a wonderful way of reducing their stress. So there's a host of positive addictions which we should engage in, and they are seen as effective stress busters. Finally, we need to connect to individuals. And although we are in a state of lockdown, the connection at this particular point of time can be either through a phone call or through so many of these channels which are available over the internet. Now, like I said, we have a time affluence, we are not short of time, and birthdays and anniversaries and events are passing by, but we are still habitually wishing everybody on the WhatsApp. We are not making the effort to make calls and to talk to people or connect to people. So you'll be surprised to know that social connectedness or staying connected to your near and dear ones is not just an effective stress buster, but it is also one of the most important recipes for well-being and happiness. If you want a sense of well-being, if you want to be happier in life, then you must be socially connected to others. Ventilation is very important. Speak, reach out to others, let others know your thoughts and feelings. And the moment you ventilate or let out your thoughts and feelings, you immediately get reassurance, you immediately get support, and on occasions, if you are having a problem, you also get problem solving skills. People will tell you how to approach a problem. So social connectedness is extremely important, and we human beings are defined in 5 words. Man is a social animal. So the word social is so integral to us. And of late, what we have been seeing prior to the pandemic is people are becoming lonely. They are not connecting to each other. Our social network seems to be dwindling. हम लोग एलियनेट होते चले जा रहे हैं, हम लोग अकेले होते चले जा रहे हैं. So this is a good time to connect to people, and all of these things would serve as effective stress busters. And not just effective stress busters, they will also enhance our sense of well-being and happiness, take care of our mental health. Finally, optimism is extremely important. In spite of, despite everything that has happened, we need to have a optimistic outlook towards the future. And optimism, you just talked about at the outset, at the introduction, you were talking about our immunity levels, how immunity is important. Now you'll be surprised to know that if you are mentally healthy and relaxed, your immunity is, it gets a wonderful boost. And if you are in a state of stress, then you may have your share of vitamins and minerals and healthy food, but your immunity seems to go for a toss. And optimism or hope towards the future is so strong that it is responsible for better mental health, better sense of well-being and happiness, better physical health, better productivity, and also longevity. Optimists may outlive pessimists by as many as 7 to 10 years.
That's a good note. I mean, but I think on that note, I should also ask you uh, that all these strategies are useful, but there's one particular thing that we are hearing a lot of, and in fact, recently a very high-profile self-harm suicide case has brought that into focus. I know that you are talking and working on it uh, a lot. You're sort of saying you've been mentioning this in some of your other public work as well. Is the importance of addressing things like self harm and suicide. Now, the world is really suddenly, India in particular, has really started taking note of this because of a high profile case recently. But uh, what we don't know is how big a problem that is during this pandemic, and what are the challenges that people are facing around that particular issue, right? Because we don't discuss it. We never talk about suicide or discuss it enough, in a sense.
Yes, absolutely. So now, as far as suicide is concerned, we need to know the data to begin with, just to give you an idea. Uh, a few years back, it was about 15 to 16 per 100,000 in India, as compared to about 10 per 100,000 in the world. So the suicide rates in India are much higher as compared to most of the countries in the world. And unfortunately, India may be the suicide capital of the world. And in the 15 to 29-year age group, suicide happens to be the most common cause of people dying. So these are the most productive years of our lives, and suicide is the most common cause of death in this population. So suicide is something which is highly prevalent in India. Now, what has happened during the pandemic is, because people are in a state of high stress, and the mechanisms by which to encounter this stress, the people may not have, they are not aware of it, and that's why it's our responsibility and duty to be telling people at this particular point of time what helps and what does not help, particularly as far as the mental health is concerned. So unfortunately, people are entering a state of hopelessness, and hopelessness ultimately can and does lead to suicidal ideation and completed suicide. So in order to, I mean, there is data which suggests that from a city like Gurgaon, I am in Gurgaon, we are having, since the lockdown, about one suicide every day. And for every completed suicide, there are actually 20 attempted suicides. So, if you now look at the numbers of the people who are attempting suicide and the numbers who are completing suicide, it's a huge number. Unfortunately, India has always tend to hush it away. We don't talk about it. We feel that if we talk about it, then the person may actually, even, there are more chances that the person may do it. It's exactly the opposite. If somebody is in a state of stress, if somebody is in a state of distress, you need to ask just a simple question: how are you doing? Are you feeling low? Is there anything I can offer, you know in order to help you? Just validating the difficulties which another person is facing goes a long way in that person feeling relieved, and relieved of his distress. And for people who may be looking depressed, appearing depressed, it's important to ask, do you have any death wishes? Do you have any suicidal ideations? And you'll be surprised to know that people actually talk about it. They are relieved to talk about it, rather than the false notion that if you talk about it, then the person may actually end up doing it. If you talk about it, then the chances are that the person is not going to do it. So at the level of the family, at the level of, our friends, if we see a change in disposition, if we see an individual who is interacting less, if we see an individual who snaps, if we see an individual who is speaking in a negative tone, saying things like kuch nahi rakha hai is duniya mein, sab kuch bekar hai, if you are hearing that sort of a tone, immediately ask about mood, offer help, and offer or ask if you are feeling, negative, or if you are feeling suicidal. And for anybody who is, it is important to connect them to the mental health professionals, psychologists, or and psychiatrists, and this can be taken care of. We need to start talking about suicide not just after an event like a high profile individual committing suicide. We need to be talking about it at all particular points of time, and even before that, we need to be talking about we need to be checking each others well-being. We use the word humane, humane. Humane, what is ultimately humane? Humane is reaching out to another person, asking, offering help, things like these. So we need to be more humane towards each other. And if we follow these little things, then we would have helped individuals a lot emotionally, identified people who may be at risk for suicide, and then they can be asked to meet up with individuals who can help in a more professional manner.
Thank you so much, आपने ये बातें कही. In particular, I want to highlight a few things, which is that Dr. Saurabh was saying. Was, of course, that for every suicide that happens, there are about 20 others that that are not successful, thankfully, and we are not talking enough about it. The second
Yes.
is that social connectedness is really very important. You need to watch out for it. And the third thing is we need to talk about it. इसके बारे में बातचीत करना बहुत बहुत ज़रूरी हो गया है. बट आप कहीं मैं वही एक बात जो उठ रही है वो भी पूछना चाहूँगा, मगर उससे पहले जस्ट लाइक टू टेल आवर व्यूअर्स वी आर we are accepting questions on our Twitter, on our Facebook, on our Instagram. Please ask whatever questions you want to ask Dr. Mehrotra, and I will bring them up to him. सवाल पूछ लीजिए मुझसे. बट आप बातचीत करने की बात कर रहे हैं, बट हम लोग तो मेंटल हेल्थ के बारे में ही बात नहीं कर रहे, राइट? मोस्ट ऑफ द टाइम, if I were to say to one person has to say to another, I believe my mental health is really in a bad state. The most usual response is that either it is nothing, ये तो कुछ है ही नहीं, और that ये ठीक हो जाएगा, आप ठीक हो जाएंगे, थोड़ा सा घर जाके टीवी देख लो या कुछ और कर लो. The thing is we are not talking enough about mental health. So do we as a society and as a country need to talk about it? Because हम ये सुनते रहते हैं India is the depression capital of the world, आप कभी कह रहे हैं India may be the suicide capital of the world. तो अब इस तरह की बातचीत में जहाँ पर ज़्यादातर लोगों से हम ये ही नहीं कह रहे हैं कि उनकी मेंटल हेल्थ में कोई इशू है, if you have no mental health issues, how do we, what kind of conversation do we need?
Okay, so even before, when we say, talking about mental health, what a country like India needs to do is India needs to get its act together and engage in what we refer to as mental health awareness. Unfortunately, many of the things which happen, many of the advices which individuals get कि जाके पिक्चर देख लो ठीक हो जाओगे, अरे ये मूड खराब है, ऐसा कुछ नहीं होता, this minimization of things, the wrong advice that we may give to individuals is because of the fact that we are not aware of what mental health disorders are all about, what are the symptoms of the mental health disorders, and what can be done about these mental health disorders. So we need to raise the level of awareness of individuals. There is a concept which is called mental health literacy. Now, mental health literacy is things as simple as recognizing that you are in a state of psychological distress, recognizing what could be responsible for this state, recognizing how you can help yourself when you are in a state of distress, and recognizing who are the individuals to reach out to if you are having psychological distress. Now, when when surveys were conducted in India to check mental health literacy, then let's say for a problem like depression, when the surveys were conducted in young adults and adolescents, only 30% of the population could identify depression, that this is a problem and these are symptoms of depression. Only 30% of the population is able to identify. 70% could not understand what it was. So the mental health literacy is not, is very poor. And when we look at some of the more serious disorders such as psychosis or, schizophrenia, then the mental health literacy drops down to less than 2%. So we are just not aware of psychological distress, its manifestations, the manner in which people can help themselves, and how to or whom to approach. So mental health literacy has to be increased. Now, when mental health literacy is enhanced, then the self-help techniques which individuals can utilize is already part of that. Effective communication is already part of that. How do we enhance this mental health literacy? We talk about it. We talk about it in social media. We talk about it in the print media, on television. We talk about it in schools. It should become part of CSR, corporate social responsibility. It should be part of the government's mandate. The government has to talk more about it. The government has to have some programs in place for mental health. Unfortunately, India has, at the political level, always worked on the concept that we are yet to take care of tuberculosis, we are yet to take care of infectious diseases. How do we then invest in mental health? Now, this is a wrong notion to have. It's not as if mental health is a luxury. Way back in 1954, the head of the World Health Organization said that without mental health, you cannot have any physical health. This is 60 years back. And 60 years have gone by and we are still struggling to understand the the value or importance of mental health. So mental health is absolutely essential if you want to be physically healthy. We need to talk about it at all possible levels, at all possible levels, institutions, media, uh, political circles, and we need to increase or enhance awareness. If we are able to do that, of course there needs to be an organizational revamp as well. We need to train more and more individuals at the phc level to be able to identify people with mental health disorders and how they can be helped and how they can be referred. So it requires a bit of a revamp, a lot of communication, a lot of awareness enhancing techniques.
Thank you so much. I think these two key points that I want to emphasize to what Saurabh was saying was that you cannot have physical health without mental health. This was a very important thing. कि मानसिक स्वास्थ्य के बिना स्वास्थ्य कभी पूरा हो ही नहीं सकता. You cannot be holistically well. The second thing is that we are not talking enough about it. You need to really start from the school level. Everybody needs to be talking about mental health in India because we are having and we have been having mental health crisis for a very long time. इस पैंडेमिक से सिर्फ ये पता लग रहा है कि ये क्राइसिस कितना बड़ा हो सकता है भारत में, मगर ये क्राइसिस काफी वक्त से चल रहा है. बहुत से सवाल आए हैं हमारे पास, so I wanted to ask you some of these questions because our viewers have reached out. Larry Gamash is asking this. He says, if you see someone who might be in trouble and you know when it's going to be, when it's time to go from conversation to intervention, when is the right time to step in and do something? This is very important. कि आप देख रहे हैं somebody is in distress and उनका मानसिक स्वास्थ्य नहीं है या उनको तनाव है. From talking to intervening, सिर्फ बातचीत करना और उससे इंटरवीन करना कौन सा सही समय है? क्योंकि ये एक बहुत मुश्किल सवाल है. अलग अलग के लिए अलग सिचुएशंस होती हैं. बताइए इसके बारे में. यू कैन टेल अस.
Right. Okay. So I think I'd like to answer it in three different aspects. One is identification. सबसे पहले हम पहचाने कि हम परेशान हैं. I am having a set of problems. You will find it surprising that people will say that मेरा मन खराब है, मैं उदास रहता हूँ, मेरे मन में बहुत नेगेटिव विचार आते हैं, and then when you summarize it for them and say that you are depressed, the thought process is कि नहीं 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 मैं depressed नहीं हूँ, right? So one, we need to understand, identify the symptoms of the fact that we are in a state of psychological distress. The second thing which we should be doing is, the moment we realize we are in a state of distress, we get the self-help techniques together. We get into a disciplined life. Anybody who's using substances of abuse, weed, alcohol, smoking, all of it are going to cause a major damage to physical and psychological health. Alcohol does not make you sleep. Alcohol does not relax you. Weed cannot be recreational. So a substantial number of mental health disorders are related to drug use. So this point is something which we didn't discuss. So what we need to do is, we need to get our act together in terms of how do we manage it at our own level, and this is called self-help. This includes, if you are doing any drugs, doing away from drugs, sleeping well, doing your exercising, reaching out to people, communicating and talking about it, right? Trying to engage in some positive addictions. You are trying to do that with very little success, and 2-3 weeks have gone by. Then it is time to take it ahead and seek a consultation, which means that a proper opinion from a mental health professional for further advice. So if this persists for more than 2 weeks, 3 weeks or more, then we say that this is a break from the norm and now we need to get in touch with somebody. And we'll be surprised to know that people come to us after years. In order to diagnose somebody with depression, the criteria around the world is a set of symptoms for 2 weeks or more. So if you are looking for a cutoff, it is 2 weeks. And we have people, and when you ask them, for how long have you been having these problems? Then even in urban population, we hear 5 saal, 7 saal. So we've been suffering from these problems from years altogether. And unfortunately, people approach only when it's gone substantially out of hand and something catastrophic is going to happen. And that's when they approach. The thing to understand and know is that early intervention leads to wonderful results. So if we intervene early, if you reach out early, the results are going to be in quick time and wonderful. So let's not delay it. Intervention should be done if the symptoms persist for a few weeks.
We've also got a couple more questions which I want to ask you. They are very operational. And I think Kayuri, for instance, is asking, you mentioned exercise. Now, she's saying, can exercise substitute medicine? Now, we know that exercise is useful for dealing with stress. So she's saying, how can we use this as a tool to overcome stress, and can it substitute medicines? I think this is also pointing to the perennial fear that we have. हमेशा डर लगा रहता है कि अगर दिमाग की दवाई मिलेगी तो शायद हम कभी उससे रिकवर नहीं कर पाएंगे. तो it's a very important question, I think, क्योंकि लोग डरते भी हैं. People are scared of going to a mental health practitioner for precisely this reason. कि हमें दवाई दे शायद. So please talk a little bit about that.
Okay, so let's see it this way, that all of us are perhaps in a state of stress, and not everybody requires medication. Medication are always for disorders, right? So when I say exercise, when I talk about meditation, when I talk about positive addictions, when I talk about social connectedness, then all of these are self-help tips. We should be doing this as part of a good lifestyle, certainly doing it if we are in a state of stress. So this is like an add-on. It's not a substitute. Exercise is not a substitute for medication, right? Exercise is something which we should be doing. It will be able to handle, let's say, the milder forms of stress. But if stress is increasing and if stress is persistent, we need to take medication. So that's very, very important to understand. I am not here using it as a substitute. I am saying that it is a good add-on. I'm also saying that not everybody who's stressed requires medication. So those who are having a mild or moderate level of stress will help themselves significantly by exercising and the other things which I talked about. Now, as far as the medication is concerned, there are a lot of myths and misconceptions about medication. One of the common ones is that it will make us sleep all the time and we will not be able to function. Now, this is absolutely not true. We only give medications for sleep to somebody who has very few sleep hours, and lack of sleep is going to be absolutely detrimental. Otherwise, a lot of medications that we use in psychiatry, they are actually activating and alerting and may impair sleep. So this needs to be gotten rid of, that psychiatric medication will cause sleep. Psychiatric medication may slow us down. No, they're not going to slow you down. They are going to make you more active. They are going to reduce your stress. They are going to reduce your anxiety. And when all of this is gone, you will actually be more productive and you're likely to be happier. So they're not going to slow you down. They are not going to induce sleep. They are not going to cause a memory loss in the long term, that if I use it for, a long period of time, am I going to lose my memory? Some people will even ask, am I going to go mad? No, nothing like this is going to happen. Is it safe for my heart? Is it safe for my liver and kidney? Absolutely safe for your heart, absolutely safe for your liver and kidney, right? Like all medications, psychiatric medications may have some side effects. And whenever these medications are prescribed, right, the doctor is going to mention or talk about these side effects to you and how these side effects will be overcome. Now, we may end up taking a paracetamol for headache, or we may end up taking a Disprin for headache without asking a doctor, just by going to a chemist. That can be more harmful and detrimental, and we don't recognize it. So psychiatric medications are safe, and when they are prescribed, you are informed about the possible side effects, and they don't continue for life. There is a duration of treatment, Once the duration is taken care of, then the medications are stopped. But we also must understand, we haven't talked about it, that therapy or counseling plays a very, very important role in the treatment of psychological distress and disorders. And therapy is like skill building. It's a lot of techniques which you are told, the manner in which you should think, right? So many of these techniques. So counseling is a very integral part of how we manage psychological disorders. Let's put it this
Uh,
way: all of us will require self help, and it's useful. Many of us will require psychological counseling, few of us may require medication.
I think that's a very good way to put it, because we should also not stigmatize whatever level of help that we need, because everybody requires different levels of help. सबको एक जैसी मदद की ज़रूरत नहीं, मगर कोई भी मदद की ज़रूरत गलत नहीं है, ज़रूरी है. I wanted to also bring up this question of technology which you referred to, because technology and the internet has taken over our lives. We are looking for our information on it. We are looking for entertainment on it. We are looking for validation. And there is just such a plethora of uh, platforms, Facebook, Twitter, Instagram, ShareChat. There was TikTok until recently, until it got banned. Now the thing is that technology is an enabler. ये ज़रूरी चीज़ है आजकल के ज़माने में. It's democratizing information. हर जने को मौका मिल रहा है. But at the same time, it is playing a very detrimental role also at various points in time. There is misinformation, there is technology and internet addiction, there is addiction, and there is also the impact that it is having on our mind. The overwhelming impact of taking a phone away from an individual for even a few hours, and how that is impacting. It is an extension of their selves now. So how do you think we should be moderating that? Because today everybody is saying, I read X on the internet, I read Y on the internet, ये कहते हैं, वो कहते हैं. अब ये बहुत जरूरी हो गया है, हम अपने घरों में बंद हैं, minimal interaction with people, so that we manage this relationship with them. How do we manage?
Okay, so the voice, I missed part of what you said, but I understand the question that you are talking about.
Oh,
Now,
sorry.
first of all, we need to understand that there is an entity called technology addiction or problematic internet use, and gaming is now an official disorder which needs to be treated. In the Western world, we have wards and people who are admitted in order to be treated for technology addiction. It comes in the form of social networking, which is your Instagram and Facebook and WhatsApp and Snapchat. It comes in the form of pornography. It comes in the form of shopping on Amazon and Flipkart. That can also be an addiction. It comes in the form of blogging, and it comes in the form of gaming. Now, technology is there in order to make our lives better, and all of us need to have or need to understand that we cannot be, or we cannot fall prey, or we cannot become addicted to technology. Technology addiction is most commonly seen in adolescents and young adults, and these are the most productive years of your life. These are the most productive years of an individual's life. So what we require is, I would use two words: the right view and the wisdom. The right view is an understanding of how addiction to technology and a lot of hours on the screen is detrimental to our physical as well as our mental health, as well as our social health, all of it, emotional health, every aspect of health that we are aware of is affected by technology. I would even go to the extent of saying that if I have a person with an alcohol addiction sitting in front of me and a technology addiction sitting in front of me, I would find the person with the alcohol addiction a bit easier to treat, because somebody who's having alcohol somewhere has an awareness that it is harmful. But somebody who's addicted to technology is highly argumentative and cannot really understand, how it is harming them. You'll be surprised to know that a research was done on teenagers in the West, and they recognized that more the screen time, more the sadness, which means that your screen time has a direct impact on your mood. Now, when you are playing video games and when you are on social media, you seem to believe that you are having a good time. But that is not true. People with more screen time are more sad, are more depressed, and people with less screen time and more face to face interaction and more outdoor interests are actually happier. So we need to get into our system, we need to get into our mind how technology is harming us psychologically, physically, socially, academically, work wise, like I said, all aspects of our health. We need to change our equation with technology. Like I said, not fall prey or victim to it. And at home, parents have to follow what are referred to as the 3 M's modeling. If parents are themselves on the mobile phones at all points of time, how can they ask their children not to do so? So they have to model appropriate behaviors. They have to mentor children, particularly young children, and they also have to monitor. So these are the 3 M's as far as technology is concerned. At home, it is modeling, mentoring, and monitoring. And we need to increase our pro-social behaviors, our outdoor. I am referring more to young adults and teenagers, and we need to get back to the things which are actually beneficial. Read from a book, buy a book and read from a book rather than read everything on Kindle, right? Do the traditional method of searching in a library. If you don't find it, then the great thing about searching in a library is that you look for one thing and you gain knowledge about five more. But when you search something on Google, you get confused about five more. So it doesn't help us. There's a lot of misinformation which is happening. There's a lot of false information which is happening. We are falling prey to it. In the hospital, we have a subset of patients who come to us only because of what they have read on Google. They have a symptom, they read it on Google, they'll come to us, headache, and they'll say, get an MRI done, I have a brain tumor. So, and these set of people are actually very, very difficult to treat. So let's change our equation with technology. Let's be wiser. Let's look at the long run. Let's not stick to the immediacy of the pleasures. I'm enjoying my video game today, and that's important. That's not how life is. If you are stuck to your video games for now, I always tell teenagers, invariably parents get their children when they are in class 11th or 12th and the boards are approaching. I invariably tell them 2 years of fun and a lifetime of misery, and 2 years of hard life or hard work and a lifetime of fun. Which one do you choose? And that's wisdom for you. That's the right view for you, right? So this is how we need to look at technology. Is becoming a big nuisance for all of us. And I'll do a very small exercise for you, and people can do it themselves. I have my phone. I go to Google. Right. Just a moment. Just give me a moment.
Sure.
So, okay. So I open Google, and what I am doing in Google is I write Facebook makes me feel. So I have mentioned 4 words on Google. Facebook makes me feel. And okay, hang on. Just give me a moment. I'm not pretty good at. Okay. So when I type Facebook makes me feel, what is it that I get? I get about 8,
Yeah.
Let's read them for you. Facebook makes me feel sick. Facebook, number 1, Facebook makes me feel I can't breathe. Facebook makes me feel nauseous. Facebook makes me feel seasick. Facebook makes me feel just like an iguana. So these are the sort of things which you get, and unfortunately, it's not far from the truth. It's not far from the truth. It is the truth. Again, you will be surprised to know that internet addiction is the worst in India and Southeast Asian countries.
Oh, wow.
If you look at US and if you look at Europe, then not many people are on Facebook. Not many people are on Facebook, and they are not always on the net. So this is more of a problem of the Southeast Asian countries. Let's have a right view, let's be wiser, and let's change our equation with technology so that it serves, uh, you know it serves us, or it is beneficial to us and does not ruin us.
Thank you so much. This is, I mean, I love the little game that you did, the little illustration that you did, because I think it really shows us the kind of mm, reactions that populations often have. We are in the last 5 minutes, and we have a few questions. One in particular, I think that we wanted to ask is. Um, Now that we are in this lack of physical freedom situation, जब बाहर नहीं जा सकते, so there are two challenges that have emerged. One is that a lot of people are inside their families, with their homes, but they do not have very positive relationships with their families, right? And the number two thing is that some people are stuck alone. And loneliness, as we know, in this rapidly urbanizing world, is turning into a big issue, a big problem, where people are successful, they live well, but they are alone. And so, for both of them, what do you suggest? Very briefly, if you could,
Okay.
suggest some things.
uh, One, first thing we need is acceptance. We need to accept the fact that this pandemic is going to take time. Our way of lives have changed, and we need to accept this new way of life, however undesirable it may be for us. That's one of the things. When the pandemic started, we mental health professionals hoped that with people spending more time with each other, relationships would mend. It gives an opportunity to mend relationships. Prior to the pandemic, everybody universally would tell you, I don't have time for my family, I don't have time for my children, I don't have time for my parents. Now, people who are staying together have enough time. And what they've realized is that when they are together, they can't seem to be able to tolerate each other so well. That's because over a period of time, we've become judgmental. We are easy to judge others. Let's not judge each other. Let's give each other some leeway. Allow others to, let's not have a situation where the moment somebody says something to you, subject that person to a judgment. So judgment is not something that we should do. Let's start looking beyond ourselves. We've been living our lives in the I, me, myself world. So let's start looking at, beyond ourselves. Let's engage in some kindness and compassion. We are born with kindness and we are born with compassion. Unfortunately, we lose it at some particular point of time, but we have it within us to be kind to each other, to be compassionate towards each other. Let's thank God and express gratitude for what we have at this particular point of time. And if this is how we manipulate our thought processes, express gratitude, right? Be kind and considerate and compassionate towards others, be non judgmental towards others, get into the habit of listening. We are happy to speak whatever is in our mind, but we hardly listen to others, empathize with others. If we are able to do this bit, we'll be able to mend our relationships. This is for people who are staying together in a family setup. For individuals who may be alone, it is important for them to reach out to others, talk to somebody every day. Talk to somebody every day, whether it's a friend, whether it's a family member. Ensure that you are reaching out to somebody every day. Ensure that you are following some sort of a schedule, some sort of a discipline to your day. That goes a long way in helping us and managing our moods. Do your bit of exercise every day. Engage some time in your hobbies. It is the duty of the organizations to find out individuals who may be staying alone, working from home, and are staying alone. And many organizations are actually already doing that. Corporates are already doing that. And they are offering a helping hand, both in terms of logistics as well as in terms of emotional support. Somebody from the HR team calls up these individuals, and just inquires about their health and inquires about their well-being. It started to happen. People are reaching out to each other, and most importantly, they need to understand that we mental health professionals are also part of the support system of everybody in the society. We may be on the most outer circle of the support system, but we are very much there, and in times of stress and crisis, we may actually be your most immediate support system. So let's understand our support systems. Let's build up on our support systems. Let's have some acceptance. Let's be kind and compassionate. Let's have gratitude towards everything that we have in life. And I think I would like to finish by saying that a psychiatrist who was Viktor Frankl, who was in the Nazi concentration camps, and he survived the Nazi concentration camps. He said something which all of us must understand and practice. And he said something to the tune of, in the most difficult times of our lives, when every last bit of our freedom has been taken away, and at this particular point of time, our freedom has been taken away, we still have the option to choose our attitude towards the situation. So you may be in the worst case scenarios, every last bit of your freedom is stripped, but you still have the choice to decide your attitude, and let that attitude be of positivity, let that attitude be of hope, and let that attitude be of reaching out to others and helping others.
Thanks so much. I think that's the perfect note to end on. We are just left with 1 minute, so I will have to ask you one question, and you'll have to respond to it very briefly. But this question has come up again and again, which is that how do we deal with the future, a future that is looking so uncertain? Just a few lines, and then we'll
So,
close.
okay, I don't know what lies ahead. So why worry?
Okay.
That's one way of looking at it. If you don't know, then why worry? But the other thing which we should do at this particular point of time is, let's be present moment focused. Let's focus on the most immediate things. Let's not get back into the disputes of the past, and let's not try and look too deep into the future. Both are sources of anxiety. Both are sources of anxiety. But we are all in this together, right? As somebody has very appropriately said, we may not all be in the same boat, but we are all in the same storm. Let us be optimistic. Let's not look too much into the future. And most importantly, happiness lies only in the present.
I think that's the sort of perfect note to close on because I think we've completely run out of time. But this line that I think Saurabh gave us is perhaps the most important one, which is that happiness lies in the present, and you get to choose the attitude that you uh, have towards the current situation, even when all your freedoms have been taken away. Thank you so much, Saurabh, and thank you all for joining us
Thank you.
today.
Thank you so much, Chapel.
Take care.